Okay, at the count of 3, don't move, okay? 1, 2, 3. Sorry. A little ouch there.
Mm-hmm.
Can you please tell me when the stinging's all gone?
What the singing?
Yeah.
It's gone.
It's gone? The stinging's gone?
Yeah.
Good. I hate the sight of pain. So that's not hurting at all right now?
No.
So can you tell me if I hurt you even one little bit in the next 10 minutes? So far you just felt the first poke?
No. When you said 1, 2,
Yeah,
it was the third.
right. But after that it hasn't hurt?
No.
Okay. So what you're going to see is a big goose egg here because I'm putting in tons of freezing.
Yeah.
So I've put in 20 cc's and you can see that the local is all in through here after that original 20 cc's. So a second needle should only go where the skin is clearly white, because if there's epinephrine there, there's lidocaine there. And so I know that the skin is clearly white right here over the trapezium. So if I go right in here, she's not going to feel this. Was I lying?
You weren't lying one bit.
Good. So that didn't hurt at all. That didn't hurt at all.
No.
Okay. So I've put in 4 cc's there without moving my needle. Now I'm going to slowly advance and come down on the side of the metacarpal. And while I'm advancing, I'm thinking in my head, blow slow before you go. Blow slow before you go. And my needle is advancing, but it's advancing gradually, not in jerks, and it's advancing so slowly that you can't see it advance, but my local is going in. And you can see by the depth of my needle that I'm clearly up beside the metacarpal, and that's not hurting at all?
No.
Good, because I hate the sight of pain. And I always make sure there's at least a centimeter of local ahead of my needle tip. So I'm just going to finish the rest of this 10 cc's right here without moving. So we got 20 cc's right there, 10 cc's there, but I went down that side of the metacarpal. Now we're going to do 10 cc's on this side of the metacarpal. So I'm going to go right here where it's clearly white, right on the side of the trapezium. Did that hurt at all?
No.
Good. So once again, I'm going to aim up around the side of that metacarpal. Blow slow before you go. Blow slow before you go. I'm going to just move your hand just a little bit so that I can see that. Tell me if I hurt you at all, okay?
Yes.
She says, don't you worry, doctor. I'm going to tell you.
Hmm.
And I'm palpating with my thumb, so I know that it's inflating. And the whole thenar eminence area is getting tense, which is what I want. Is that hurting there?
Just a tinge.
Just a tiny little
It's like a discomfort.
discomfort. More like, and did it hurt more than the first poke, or about the same, or?
About the same.
About the same as the first poke. Okay. What about now?
Now I'm fine.
No discomfort now. Great. So we did both your carpal tunnel and your ulnar nerves.
Yes.
carpal tunnel ulnar nerve at the same time, carpal tunnel ulnar nerve at the same time. And how sore was the freezing for that?
It wasn't.
Yeah.
The freezing, just a poke the first time,
Right,
that's it.
Right. Would you rather have been asleep for that, or?
No,
No.
no,
And this is pretty much it for the freezing this time. Would you rather have been asleep?
no,
No.
no, it's perfect.
Okay, great, okay. So we have 40 cc's in there on the whole radial side of the hand, 10 cc's down this metacarpal, 10 cc's down this metacarpal, and 20 cc's right here. So we're pretty much all done except for that side of the metacarpal on the inside. And during the surgery, I like to put some right in the joint. But at this point, before the surgery, I'm going to come in on this side and do the volar side of the metacarpal. So I'm going to do that now. Did that hurt you at all?
No,
So the dorsal side of the metacarpal is right there. And I'm going to just go down, blowing before I go. Aiming between the metacarpal and the index metacarpal base. I can feel that with my long finger, so I'm actually aiming to my long finger. Is that hurting at all?
no,
There we go. I'm now underneath the metacarpal. I felt myself slide in there. I'm on the palmar side of the metacarpal. Is that hurting at all?
no, just a little discomfort,
A little discomfort, okay.
like a little pressure.
Pressure, yeah. And I can feel it expand between the index and thumb metacarpal bases with my long finger. So now the palmar side of the metacarpal is totally blown up. So we now have 50 cc's in there, and we hurt her 2 times. Third time was a pressure.
Just pressure.
Okay,
I think the other one really wasn't a hurt, it was more pressure.
more pressure.
Yeah.
Okay, all right, great.